Okay, so I'm going to first confirm my orders with the doctor and wash my hands. I'm gonna knock on the door. Hi, my name is Elizabeth Orbrook, and I will be the nurse today for your baby. If you could just confirm with me her name and date of birth. Thank you. And that checks out with her wristband. And now I'm going to be doing a newborn head to toe assessment. That should take less than 20 minutes. I'm just going to be palpating, inspecting everything and just documenting it in the chart so we know where to go from here. Now I'm going to just gather all my equipment and close the curtain. And now I'm going to assess for work nurse safety. Looks good. And I'm gonna wash my hands one more time and put gloves on. So first, patient is a female who was born 9 hours ago via spontaneous vaginal delivery at full term, 39 weeks, 2 days, with no complications and no trauma was noted. So first, we are going to, overall, patient appears to be not in any distress. Breathing is non-labored, and there's no signs of active hemorrhage or anything like that. Next, we're gonna do some vital signs. And so I'm going to get the thermometer and do an axillary temperature. 98.6 is what I got, which is within normal limits. Now I'm going to get the heart rate and respiratory rate by oscillating for 1 minute at the apex of the heart. All right, heart rate is 135 and respiratory rate is 45, which both are also within normal limits. Next, we're gonna get a weight. To do that, we're gonna remove the diaper for a more accurate measurement. Place her on the scale, 8 pounds, 12 ounces. So next we're gonna get her length. Measure from her heel to her head. She is 21 inches with the leg extended. And now we're gonna do a head circumference. So I'm gonna wrap the measuring tape around her eyebrow line. It's about 33 centimeters. Now I'm gonna do the same thing around her chest at the nipple line, and it's 31 centimeters. All right, so those are all within normal limits. Next, I'm gonna assess her skin. Overall, it is pink with some signs of peripheral acrocyanosis. I do note some vernix in the skin folds of the extremities, as well as milia on the bridge of the nose, and some petechiae around the anterior portion of the face, probably from the spontaneous vaginal canal delivery. No Mongolian spots are noted, and I do see some erythema toxicum around her cheeks, which is kind of like a red pin-like rash looking. And she also has laguno on her upper shoulders present. Now I'm going to assess her head, or inspect it. Head is normal cephalic, round, and symmetrical. Now I'm going to palpate her fontanelles, her posterior and anterior. They are soft and flat. No bulging is noted. No cephalohematoma, but there is molding with some elongation of the head and some caput as well. Next, going to assess her facial symmetry. Eyes, nose, mouth, and ears all appear midline and symmetrical. And next, we're going to do the eyes. So I'm going to use my pen light to shine a light to test pearl. Pupils are equal, round, and reactive to light. Her iris is a grayish color with no strabismus noted. And her conjunctiva is pink, slightly pink with a clear drainage. So we'll just monitor that. Next, we're going to assess her nares for patency. And both nares are patent bilaterally. She is breathing out of them normally. Next, we're going to check her ears. Ears appear to be well formed and aligned with in proportion to the outer canthus of her eyes, symmetrically. And no dimpling is noted, but there is some vernix noted inside her ear, which is normal. And it will just come out on its own. Now I'm going to change my gloves and wash my hands and assess the inside of her mouth. So I am going to palpate for her soft and hard palate to see if they're intact. Both her hard and soft palate are intact. No Epstein pearls are noted. While I was assessing for her palates, I did note her sucking reflex is intact, and I will assess her swallow reflex later. Next, we're going to move on to the neck and clavicle. They appear to be intact. No signs of trauma. Now we're going to move on to the chest. So chest appears to be even, not concave, not barrel chested. Nipples appear to be symmetrical, not engorged, normal color and size. Now we are going to auscultate her heart and lung sounds for a minute. And we're going to do that anteriorly and posteriorly. Heart sounds are normal. No murmur is noted. Breast sounds, though, have some crackles and are a little damp, which is normal after birth, so we'll just keep monitoring that. But she appears to be breathing without any difficulty. Next, we're going to assess her abdomen. So I noticed that it's soft, not distended, and not concave. Parents did inform to me that they fed her earlier, so she should have bowel sounds. So let's check. Okay, bowel sounds are present. Her umbilical cord is there as well. It's intact. I do see 2 arteries and 1 vein. No infection is noted. Parents did inform to me that she did void earlier and it was normal appearing to them. And so we'll just monitor that, but she has not had a bowel movement yet. And so I told them that they should just be aware that the first stool is a tardy-like black substance called meconium, and just to be on the lookout for that. But since she fed, she should have a bowel movement within the next 24 hours. Now I'm going to move on to her extremities. During this exam, I have noticed that they're moving equally and bilaterally. She has good muscle tone and good range of motion. No clubbing of the feet noted. I'm going to do a test to check for hip dislocation called Ottolani. I'm just going to move the hip out and in. No signs of Ottolani. And she has 10 fingers and 10 toes, 5 on each side. And no noticeable ecchymosis or any trauma to the body in birth. Now I'm going to do the reflexes. So the first is the Moro reflex, which is the starter reflex. So I'm going to place her in the crib and just move my hand down like I'm dropping her, and her arms moved up, which is a positive sign. So her Moro reflex is intact. Next, I'm going to do the tonic neck reflex. So as I turn her head that to one direction, her arm is extended that same way with the other flexed. And as I turn it slightly gently to the other side, the same thing happens. Arm is extended and the other is flexed. So tonic neck is intact. Next, I'm gonna do the rooting reflex by rubbing my finger along her cheek, and she moves towards my finger. So rooting reflex is intact. Earlier I assessed the sucking, but I'm going to go ahead and have the parents feed her so I can assess for sucking and swallowing as well. All right, sucking and swallowing is intact. Now I'm going to place my fingers inside her palms, and she grips down on them bilaterally, so palmar reflex is intact. I'm gonna do the same thing to her toes. Her toes grip down, and so plantar reflex is intact. Next is the stepping reflex. So I'm going to have her place her foot on one surface, and the other is raising like a step. Good, and the other on the other side. Good. So stepping reflex is intact. Next, I'm gonna do the Babinski. So I'm gonna run my finger up and across, and her toes flail outward. And now I'm gonna try the other side. Same thing, flailing outward. So that's a positive sign of the Babinski. So Babinski is intact. And now we're going to do the trunk and curvature test. And while I'm doing that, I'm going to assess her spine. Her spine is, seems like the vertebrae are all aligned. There's no openings noted. And while I'm doing this, I'm running my finger along her spine, curving it, and her body is turning to that curve, both sides. So trunk and curvature is intact. Reflex. And I'm also going to change my gloves now and inspect her genitalia by removing her diaper real quick. And I do note that the labia minora and majora are present. And now I'm also going to assess her anus. I'm checking her sphincter muscles, and it is patent. So anus is patent. Now I'm going to put the diaper back on. And for her behavioral state, she was in a deep sleep prior to this assessment, but has been having a good strong cry throughout it. And she prefers to be swaddled when she's in a deep sleep per the parents. And so, but she is consolable during crying periods. Now, that completes my assessment today. I'm going to put her in her crib and right next to your bed with the call bell in reach. Is there anything else I can do for you? No? All right, so I'm gonna gather all my stuff and wash my hands, and now I'm gonna go document. Thank you for your time.